Reduction in late mortality among 5-year survivors of childhood cancer. The Childhood Cancer Survivor Study has assembled a large cohort data for assessment for late mortality. 5-year survival rates for most childhood cancer have improved significantly over the past 4 decades. In the modern era of cancer treatment, more than 80% of children diagnosed with pediatric malignancy will become 5-year survivors of their cancer, due largely to the use of advanced diagnostic modalities and improvements in surgical and radiation therapy techniques, combination chemotherapy, and supportive care. This dramatic increase in survival has resulted in a new and growing population of long-term survivors of childhood cancer that did not exist just a few decades ago. Currently, it's estimated that 1 in every 640 young adults between the ages of 20 and 39 is a survivor of pediatric cancer.
We looked at 34,000 survivors of childhood cancer, all of whom were survivors at the 5-year time point. So they made it to that main benchmark that we call 5-year survival. But the question was to look beyond that 5-year survival and look at the risk for mortality. In the past, we've known that 1 in 5 survivors, even the ones who make it to the 5-year time point, will be deceased by age 30.
The cause of most childhood cancer are not known. About 5% of all cancer in children are caused by an inherited genetic mutation, a mutation that can be passed from parents to their children. Most cancer in children, like those in adults, are thought to develop as a result of mutation in genes that lead to uncontrolled cell growth and eventually cancer. In adults, these gene mutations are often the result of exposure to environmental factors such as cigarette smoke, asbestos, and ultraviolet radiation from the sun. However, environmental causes of childhood cancer have been difficult to identify, partly because cancer in children is rare and partly because it's difficult to determine that children might have been exposed too early in their development.
Roughly 10,000 children are diagnosed with cancer.
In childhood, the 3 most common types of cancer are leukemia, tumors of the brain or central nervous system, and another type of nervous system cancer called neuroblastoma.
While childhood
We have pros and cons. The advantages are the opportunity to gain new knowledge about the long-term effects of cancer and therapy, knowledge that can be used to help design treatment protocols and intervention strategies that will increase survival and minimize harmful health effects. 2. The obligation to educate survivors about the potential impacts of cancer diagnosis and treatment on their health and implement programs for the prevention and early detection of late effects. We have disadvantages. Childhood cancer make up less than 1% of all cancer diagnosed each year. About 10,380 children in the United States under the age of 50 will be diagnosed with cancer in 2016. Some children inherit DNA change from a parent that increase the risk of certain types of cancer. Acquired mutation is started in one cell. That cell then passes the mutation on to all the cells that come from it. These acquired DNA changes are only in the present cancer cells and will not be passed on to his or children. Some of the possible late effects of cancer treatment include heart or lung problems due to certain chemotherapy drugs or radiation therapy to the chest area, a slow or delayed growth of development in the bones or overall, change in sexual development and ability to have children, learning problems, and increased risk of other cancer later in life.
Thank you for the opportunity to present to you the reduction in late mortality among 5-year survivors of childhood cancer. This is a report from the Childhood Cancer Survivor Study. The improvement in cure rate for childhood cancer really is one of the success stories of modern medicine. If you go back to the 1960s, less than 30 to 40% of children would survive their cancer. Currently, over 83% of children will become 5-year survivors.
Okay, now we have issues applied in Ecuador. The 5-year overall survival rate among adolescents aged 15 to 19 years with cancer exceeded 80% in 97 and 2013, similar to that among younger children, 84% versus 83%. However, for a specific diagnosis, survival is lower for 15 to 19 years old than for younger children. For example, the 5-year survival rate for acute lymphoblastic leukemia in 2013 was 91% for children younger than 50 years, compared with 74% for adolescents aged 50 to 19 years. Some evidence suggests that adolescents and young adults with acute lymphoblastic leukemia may have better outcomes if they are treated with pediatric treatment regimens than if they receive adult treatment regimens. The improvement in 5-year survival rates for 50 to 90 years old with acute lymphoblastic leukemia from approximately 50% in the early 1990 to 74% in approximately 50 in 1987 to 2013 may reflect greater use of these pediatric treatment regimens. Between 1999 and 2014, the cancer death rate dropped the most from 1 to 4 years old, 26%, followed by that for 50 to 90 years old, 22%, 10 to 14 years old, 19%, and 5 to 9 years old, 14%.
Who's very popular that everybody loves? What about Ella? You ever watch? Yeah. My name is Veronica. I'm 11 years old. I had bone cancer. I'm a cancer survivor.
And we have another video and then conclusions. Conclusions. Survivors of childhood cancer need follow-up care and enhanced medical surveillance for the rest of their life because of the risk of complications that can occur many years after they complete treatment for their cancer. Long-term follow-up analysis of a cohort of survivors of childhood cancer treated between 1970 and 1986 has shown that cancer survivors remain at risk of complications and premature death as they age. with more than half of survivors having experienced a severe or disabling complication or even death by the time they reach age 50 years. Children treated Children treated in more recent decades may have lower rates of late complication or mortality due to modification in treatment regimens to reduce exposures to radiotherapy and chemotherapy, increase efforts for detect late effects as early as possible, and improvement in medical care for late effects of therapy. Thank you.